Mary-Louise McLaws in Sydney, an expert advisor to the World Health Organization. Thank you so much for joining us on the program. Now, how likely is it that Trump's claims are true here? Can they have a vaccine ready to be used on patients as early as December?
Look, I believe that's very optimistic, and I understand why leaders want to be optimistic, but there are many phases of a drug trial. And one of them, for example, phase 1, which apparently the UK believe they'll be ready by July maybe, and Australia also maybe May, that requires about 500 people to be tested for what we call dosing for toxicity. Now, that usually takes anywhere between several months up to even 2 years sometimes. So phase 1 can be maybe shortened, let's say by 2 months. Then there's phase 2 for efficacy and side effects. Then once you give the patients or the volunteers the vaccine, they have to wait for 28 days to look for side effects, and then another 90 days to look for serious side effects. So that takes about 6 months often, if it's sped up. Then one of the last phases, they'll need 6,000 people to trial this, and that usually takes about a year, and that's to look for efficacy and further safety. Now, it doesn't stop there. Then they have to write up and analyze all of the data and get FDA approval, and that can take up to 6 months. But it doesn't stop there. Then they have to produce it. Now, most of the producers say it may take 18 months to produce. So we're looking for at least at a race, maybe mid next year. And there are many other issues that will slow this down. For example, if it's a vaccine related to the binding site, the ACE2, it's very hard to test it in an animal before you test it on humans, because the only animals that have the ACE2 receptor site are cats and the rhesus monkey. Now, some virologists may be able to modify an animal to become genetically modified, but that's very time consuming and causes a lot of headaches with ethics approval.
And I'm assuming that's a part of the biggest challenges in producing a vaccine in numbers large enough to meet the demands of people across the world. What other challenges do they face when producing a vaccine like this?
Well, look, apart from all the drug trials, there's also an idea of what the efficacy is. How many people do they expect the vaccine to work in? And we have that for, say, influenza. We expect a certain level for it to work in, for the patient to elicit an antibody response. Then they have to make what's called a titer test in a laboratory, so that when you're vaccinated, they can take some blood and test to see whether or not you've built up the antibodies to it. Now, they don't have a test for that yet. So there are many other issues. And there's a new trial in America called an RNA trial, and that's where it injects some of the genetic material so that the body then builds up its own antibodies. And that's a new way of doing things. Could be potentially dangerous. It may be potentially difficult for immunocompromised patients as well. And then, of course, getting back to the production of it. I mean, America has over 300 million people to get the vaccine produced for them. And then, of course, the UK have 68 million. And then you're talking about billions of people in China, Africa, etc. So it will take a very long time to roll this out, let alone develop it.
All right. Mary-Louise McLaws, thank you so much for that analysis. As always, it's good to see you.